Hello, my name is Anjali Shah, and I am representing my research team, SicklED, here at Lehigh University. On SicklED, we are working on developing a low-cost, point-of-care lateral flow screening device for sickle cell disease to be first implemented in Sierra Leone, Africa. Sickle cell disease is a recessive genetic blood disorder that arises when an individual has an abnormal variant of hemoglobin called HbS due to a genetic mutation where there is a substitution of valine to glutamic acid of the 7th amino acid on the beta globin chain on chromosome 11. Healthy hemoglobin is known as HbA. HbS causes red blood cells to become sickle-shaped, causing complications in blood circulation, such as blocking blood flow and creating blood clots. These effects lead to pain crises, anemia, and other types of symptoms. The symptoms of sickle cell disease can range from mild to severe, depending on the individual's sickle cell disease genotype. Globally, around 300,000 babies are born each year with sickle cell disease, and the majority of them are born in low to middle-income countries. 50 to 90% of these individuals in sub-Saharan Africa die before the age of 5. The range is so large due to the lack of testing to reliably determine the cause of death. In the early 20th century, the United States also had to face the challenge of overcoming sickle cell disease. And it wasn't until the 1970s when legislative intervention allowed for the allocation of resources to save lives. Biomedical innovations such as hydroxyurea and early diagnostic methods like high-performance liquid chromatography and isoelectric focusing has allowed for the patient life expectancy to grow beyond the age of 10. And today, sickle cell disease is a livable condition in high-income countries. As mentioned before, managing the disease through early diagnosis and treatment plays a very critical part in the lifestyle of an affected person. But unfortunately, many of these countries lack the resources such as awareness, financial costs, stable electricity, and hygienic environments to actually do so. Unlike the United States, there is no routine newborn screening for sickle cell disease in Sierra Leone. Current diagnostic methods for sickle cell disease in Sierra Leone involve an evaluation of present symptoms or the conduction of a sickling test, which both fall short of definitive accuracy. It should also be noted that waiting until symptoms are present to evaluate for sickle cell disease makes it more difficult to manage the disease, as it has likely gotten to a more severe state. A dry blood clot sampling is also another type of method for diagnosing sickle cell disease, but much less commonly used. These tests also require materials that many public clinics in Sierra Leone don't have access to or are too expensive, such as a microscope, lancets, slides, covers, etc. So our device is a point-of-care lateral flow diagnostic test strip that is intended to be low cost and easy to use for implementation in low to middle income countries, starting with Sierra Leone. Our dynamic range is designed to account for newborns to adults because we are targeting the newborn population to be diagnosed for early action on treatment plans to lessen the severity of symptoms in the future. Our test strip is spotted with control HbA and HbS antibodies. When the blood sample runs up the test strip through capillary flow, the antigens within the sample bind to their respective antibodies, allowing test lines to appear. The control line should appear in all 3 diagnostic cases that our test strip diagnoses for. When the control and HbA lines show up, it diagnoses the individual negative for sickle cell disease. When all 3 test lines appear, it diagnoses the individual having the sickle cell trait. When the control and HbS line appear, it diagnoses the individual positive for sickle cell disease. We improve the accuracy of our device through eliminating a phenomenon called the hook effect, which basically is the oversaturation of hemoglobin on the test strip. When there is too much hemoglobin in the sample, it can lead to inaccurate diagnostic results due to the analyte blocking the bead from not being able to bind to the test strip. Some of the other sickle cell disease diagnostic devices in the market utilize a dilution step to lower the concentration of hemoglobin within the sample. Our device does a similar effect through a wash step that removes the extra antigens that are not binded to their respective spotted antibodies on the test strip. By not diluting the blood sample, our device is more accurately able to test on newborn babies in addition to adults. Newborn babies have more fetal hemoglobin and a very little amount of mature hemoglobin in their blood. So diluting the blood would remove that small amount of adult hemoglobin that is needed for our device to diagnose. Thus, other devices on the market cannot accurately diagnose babies, while our device has a dynamic range of testing newborns to adults. Through the Lehigh Global Social Impact Fellowship, we have the opportunity to annually travel to Sierra Leone for fieldwork, and we just traveled there this past August. Our fieldwork included a perception and healthcare system study, a market evaluation, and validating our device in country. We conducted a perception healthcare system studies to talk to workers within the healthcare system, as well as general community members and sickle cell patients, to learn more about their understanding of sickle cell disease and the current diagnostic and treatment pathways, and we completed over 75 interviews. And based on our findings from this study, our team has diligently been writing a paper to be published on the perceptions of sickle cell disease in Sierra Leone. We also took note of the operations in which our device would be implemented in the future, and had the opportunity to run our device with patient blood samples at a specialized Sickle Cell Carers Awareness Network clinic in the Kono district. Looking ahead, our future goals include to continue improving the specificity and sensitivity of the device, optimizing its cost, entering a clinical trials phase to test the device with real blood samples, and preparing for upcoming fieldwork. My team and I would like to thank our partners, World Hope International, Sickle Cell Society, Sickle Cell Carers Awareness Network, the Pharmacy Board of Sierra Leone, and OraSure Technologies and Rockland Immunochemicals here in the US. We would also like to thank Dr. Chang and Vice Provost Mehta. Thank you so much again.